Welcome back to KVUE News Daybreak. It is now 6:33. More and more businesses across the state and right here in Austin continuing to open their doors as the coronavirus continues to spread in Texas and in Travis County. County officials reporting 32 new cases on Sunday. Now 2,127 cases in the county. Officials also estimate 713 people have now recovered from the virus, tested positive and gotten better, which is good news. While county and city leaders want to see that number keep going up, they remind us we all have to still play our part to stop the spread of the coronavirus. Continuing our discussion this morning with Austin Mayor Steve Adler. Mayor Adler, we have wrapped up now our second weekend, a full weekend of a lot of local businesses kind of phasing back in to business. What is your take on how Austinites, from what you've seen around town, if you've had a chance to see much outside of your house, on how Austin is doing with this phasing in of reopening these businesses?
Well, we don't know for sure. By the end of this week, we probably ought to start seeing numbers that reflect the changes 2 weeks earlier, because there's that 2-week lag, and then we'll know more. But we've been looking at some of the information that you can get that indicates how many people they track cell phone and how they move around a city. It's apparent that we have more interactions now than we had 3 weeks ago and 4 weeks ago. But what we don't know is how those increased interactions are going to translate to new cases and new hospitalizations. Those are the numbers that we key on. As I go around the city, it looks to me like most people are still doing this cautiously. They're still staying at home when they can. Many people are still social distancing. I am real encouraged by the number of people that we see wearing face coverings in stores. But at the same time, I've looked in the window at some of the retail establishments and I've seen people without face coverings at checkout counters. The employee is wearing the face covering, which protects the customer. I just don't understand why a customer goes to a checkout counter with an employee who has to work without wearing a face covering. It's rude. It's just not taking care of the person who's the checker in that situation. I wish everybody wore face coverings.
Mayor, you mentioned the data, and there's a lot of data involved with this pandemic. We've seen it really from the very beginning. The governor's talked about using the metric of positive case percentage as a gauge for kind of moving forward and reopening businesses with the decisions he's making. What data do you look at? What is important for you and your office and city officials in Austin to know when it's the right time to move forward?
We're looking at a lot of different data and a lot of different sources, but probably for me, the most important data is taking a look at hospitalizations. That would be the total cumulative count of hospitalizations, the total number of people who are in our hospital at any one point in time, but also the number of new cases on any given day. When you start taking a look at the number of total new cases, to a large degree, that's dependent on the number of tests that you give. As you give more tests, you're going to find more people. And until we're able to test everybody in the community, we're really not going to know about the penetration in our community, how many people actually have it as a percentage of the total. The one number that tells the truth, because it is exactly what it is hospitalizations. And frankly, when the system gets stressed, it's because we have too many people going to the hospital and we can't give everybody the care that they should get. Not only the people with COVID, but someone with a heart attack or involved in an automobile accident. So I key on the hospitalization number. That's a 2 to 3 week lag number, though, because an infection today doesn't show up as a hospitalization for another 3 weeks. And that's why I want us to take this as slowly as we possibly can so that we can see that kind of data become available to us so we can assess what we're doing.
Mayor Adler, are you and council members tested regularly? Have you been tested?
I have not been tested. Council members are under the same regime that everybody in the public is. At the very first sign of a symptom, I'm going to sign up for the free test, as should everybody in this city. At the very first sign of a symptom, you should go online and get assessed. There's a free test. You don't need a doctor. And the council and I are in that same place, not like the president. I think the president's getting tested every day or something. But we're using the same protocols and the same procedures as everybody else in the city.
Finally, Mayor, one last question. Let's end on a high note. I read over the weekend that in the United States, Austin is considered one city that's poised to rebound quickly once this is all over with, once we manage to beat the virus. I assume you would agree with that.
Absolutely, and I think that is true, and we have a history of being able to rebound quickly from national economic crises. And I think the reason for that is because of the people that are here. We have a very resilient community. We have a lot of people in our community that are able to work from home. We have so many of the ingredients that are necessary for an economy to come back strong. It's one of the reasons why I choose to live here.
We're all looking forward to that day, no doubt. Mayor Adler, again, thank you so much for being so generous with your time for us here on Daybreak. We appreciate your comments this morning.
Thank you, Ryan.
All right.
Be safe.
Absolutely. You as well, Mayor Adler.